Putting your baby safely to bed sounds really simple, doesn't it?
But even since we were new mums, things have changed.
Sadly, there are still some babies who die from unexplained causes, or cot death as the papers call it. But the good news is we know a lot more about it these days than we used to.
So rather than worry about it, the best plan is to do all you can to prevent it.
One thing we know for sure is that a baby is far more likely to die in their sleep if they're around someone who smokes.
One of the reasons is that their tiny lungs work a lot harder than ours, so they take in more of the smoke.
Smoking out of the window or blowing smoke away from the baby just isn't enough. If you or any of your family and friends can't stop smoking altogether, then only smoke outside with the door shut.
As well as being a cause of cot death, anyone smoking around babies and children can cause breathing problems and other illnesses which can affect them for the rest of their lives.
We also know that being too warm can be bad for babies. Keep rooms around 18 degrees centigrade.
Which can feel quite cool when you come out of hospital where it's a bit warmer because babies arrive wet and get cold quickly.
Don't cover your baby's head in the house.
So those woolly hats we used to cover up with are definitely a no-no.
And only use sheets and thin blankets for babies under 12 months old.
Just because they sell those pretty bumpers and quilts in the shops doesn't make it right. They can be very dangerous for a small baby.
So where should baby sleep? Is it best to snuggle in with mum? Well, actually, no. Best place for baby is in their own cot or crib next to your bed for at least the first 6 months.
Sure, you'll pick up baby and into your bed for feeds during the night, but afterwards put them back in their own cot.
Always lie them flat on their back to sleep. Put their feet at the foot of their bed, then they can't wriggle down and get caught under blankets. Make up their bed from the bottom, loosely tucking in their sheet and blanket, but leaving their arms free.
Sometimes their little hands may feel cool, but if you feel their chest under their vests and pyjamas, it should feel comfortably warm, so they're okay.
Don't have your baby in bed with you or your partner if you've been smoking, got drunk, or taken any drugs that could make you sleepy or behave differently.
And never sleep with your baby on a sofa or armchair, because when you nod off, they could snuggle down under you or the cushions and suffocate.
Breastfeeding's a great start too. Breastfed babies are a third less likely to be a victim of cot death.
And it means no one has to make a dash to the kitchen in the middle of the night.
We can't promise you won't have some sleepless nights with a new baby, but if you follow these golden rules, you will give your baby a much better start.
Sweet dreams!